Hi everyone, my name is Omar Ahmed and I'm with Cressalon, the makers of TRAUMAGEL, the first FDA-cleared and flowable device designed to stop traumatic bleeding. We're here today to train you on what TRAUMAGEL is, where it can be used, and how to use it both effectively and safely. TRAUMAGEL is indicated for temporary external use for controlling moderate to severe bleeding. TRAUMAGEL is supplied as a 30 ml syringe filled with a plant-based gel comprised of sodium alginate and polyacetyl D-glucosamine. The gel is opaque, tan in color, and very viscous. The gel is highly adhesive and cohesive while still easy to remove at definitive care. The gel is comprised of positively and negatively charged polymers, which are known to have benefits in hemorrhage control. Once the clot is formed, TRAUMAGEL's non-porous nature ensures that the device is not integrated with the clot. Absorbent materials like gauzes, sponges, and powders rely on absorbing blood to work effectively to stop bleeding, but bear the risk of rebleeding when perturbed or removed. In contrast, TRAUMAGEL can be simply washed away, leaving behind that robust clot without disturbing it. TRAUMAGEL can be used on a variety of wound types, including but not limited to junctional hemorrhages, deep penetrating wounds, and external moderate to severely bleeding traumas. Now, let's discuss how to effectively use TRAUMAGEL to stop bleeding. Using TRAUMAGEL is simple and easy, which is especially important in austere environments or in the field. Our team spared no expense streamlining and improving on the issues that medical professionals face with wound packing, tourniquet use, and use of existing hemostatic devices. Retrieve one TRAUMAGEL syringe from the pouch. TRAUMAGEL does not require preparation. Identify the source of bleeding. Dry the wound with gauze or suction, clearing as much blood from the site as possible. This will allow the hemostatic gel to come in direct contact with the source of bleeding when applied. When ready to use, unscrew the applicator cap, remove gauze, and insert the syringe tip deeply into the wound as close to the bleeding source as possible. Firmly and quickly expel all contents into the wound, and once all material has been deployed, withdraw the applicator as quickly as possible. Place gauze in the wound opening atop the applied TRAUMAGEL, ensuring all gauze is inside the wound area and the wound is sufficiently covered. Apply moderate palm over palm compression in the shape of a plus sign, covering as much surface area as you can. Continue compression for 3 minutes or until hemostasis is achieved. Avoid ejecting any of the underlying TRAUMAGEL in the process. If you've done so, it may mean you've applied too much force during compression. For narrow or small aperture wounds, form a seal with the syringe tip against the wound opening and expel TRAUMAGEL as quickly as you can, fully into the wound, ensuring you have a seal around the circumference of the wound area. For shallow wounds, it is important to press the syringe tip against the wound and expel the gel such that it spreads. Apply gentle compression in the event of being used on head lacerations due to the fact that the patient experience is very important and we don't want to put them in an undue, uncomfortable situation. Continue to apply moderate palm over palm compression in the shape of a plus sign for 3 minutes or until hemostasis is achieved. For small penetrating wounds where the TRAUMAGEL syringe cannot fit into the wound area, it is vital to form a seal with the syringe tip prior to administration of the gel. It helps to grip the TRAUMAGEL syringe in such a way that you can ensure that seal is being maintained as the gel is being expelled. For through-and-through wounds, it's important to actually ensure the gel is applied until you see gel coming out of the other side. If presented with a through-and-through wound, you may want to apply compression either on the side that is more briskly bleeding or apply compression at both sites of bleeding until hemostasis is achieved. There are some important do's and don'ts to consider during application of TRAUMAGEL. Do: dry the wound as best as you can prior to using TRAUMAGEL. The less blood that is present at the wound site, the better TRAUMAGEL can adhere. Don't leave gauze or other material in the wound prior to administering TRAUMAGEL. Do: insert the syringe as deeply into the wound as possible. Don't expel TRAUMAGEL before the syringe is in contact with the bleed. Do expel all of the gel while treating to ensure the highest odds of success. Don't use a partial amount of gel, as it may risk slower times to hemostasis or higher rebleed risk. Do use 3 minutes of palm over palm compression, cupping the wound and ensuring back pressure of about 40 to 60 pounds. Less is more. Don't insert fingertips into the wound when applying compression. This is more traumatic for the patient than is needed and may risk exposing you to sharp bone, bullet fragments, or other debris that may cause you or the patient injury. Do apply the gel as directly to the wound as possible. Don't apply the gel into vasculature due to risk of thrombus or material embolization downstream. Next up is removal. While removal is often not needed in the case of first responder application, it is important for all users of TRAUMAGEL to understand the steps, especially once a patient has arrived at definitive care. TRAUMAGEL must be removed within 24 hours of use. In order to remove TRAUMAGEL, follow these steps. 1. Remove the entire gel so that you can begin the process of repairing the wound. Soak gauze with saline to ensure you fully remove any gel that is visible in the wound. You may also soak the wound itself in the event that gauze is not available. If there are any remnants of gel in the wound, use saline lavage to ensure the wound is fully clean of material before beginning wound repair. Do slowly and gently remove gauze and TRAUMAGEL from the wound site. Don't heavily debride the wound during removal. Doing so may result in rebleeding. Do lavage during removal where applicable to flush the wound site of all residual material. Don't leave any residual material in the wound following removal. TRAUMAGEL is likely to be used in non-sterile environments, so any residual material left behind may impinge unwanted foreign material from the environment of treatment. Do repair the wound following successful product removal. Don't use TRAUMAGEL as a sealant or for tissue approximation. Do verify that no rebleeding has happened post-removal. Don't remove the gauze or gel before the patient has been stabilized and arrived at definitive care. Removal prior to stabilization may result in less favorable outcomes. Congratulations! You've now been trained in using TRAUMAGEL to stop traumatic bleeding and to hopefully save lives. You can always return to this training to practice application, removal, and refresh your memory on how to safely and effectively use TRAUMAGEL. Thank you.